Hi everyone, my name is Ariel, and we'll be going over today how to process peripheral blood into PBMCs using SepMate. SepMate is a unique product from Stem Cell Technologies that helps make the process of going from whole blood to PBMCs faster and easier. Now, to be clear, it's not going to increase the efficiency of removing the RBCs or the granulocytes from whole blood. However, it will make it faster and easier, which can help reduce the variability between technicians. SepMate is a unique product from Stem Cell Technologies that has a plastic insert inside this 50 ml tube. What this insert allows is for density media, such as lymphoprep or phycol, to be dispensed through the center aperture. And then once it's prepared, you can dispense diluted whole blood through the top. Afterwards, you can take this tube and spin it in the centrifuge with the brake on. And what this allows is for you to then pour out your PBMCs. So you can go from whole blood to PBMCs very quickly. To perform a SepMate density spin, what you will need is, of course, peripheral whole blood, a SepMate tube, density media such as lymphoprep or phycol, an empty tube in which to dispense your blood and then dilute it with TBS and 2% FBS. You will also need serological pipettes, pipette aids, as well as tips for counting, and also some liquid waste as well as a waste bag. The other consideration, which is important, is to make sure that all your reagents are at room temperature and that your centrifuge is also at room temperature. You don't want it to be cold because that will impede the ability of the density spin to happen. So to prepare your SepMate tube, what you're going to want to first do is to have a pipette. Then you open up your SepMate tube, and then you want to take out 15 milliliters of your density gradient media, such as phycol or lymphoprep. And you want to ensure to use the graduations on the side of the serological pipette, not on the side of the SepMate tube. And then you will just place this tip right at the bottom, and then start dispensing. A good tip is that as you are dispensing the density media underneath the insert, you'll see that you only have 1 or 2 mils left, so you can physically lift the tip up off the center hole, and that minimizes how much air bubbles will go underneath. Okay. What I do want to stress is the importance that you have some density media above the insert. Okay, so that's a common error that some people might make, is that they might dispense just below or at the insert, but you actually want to dispense 15 mils from the graduated pipette. So you purposely want to have about 1 to 2 mils above the insert. That is important. So in this case, we're going to be using 5 milliliters of whole blood. If you were using less than 5 milliliters, we do have a SepMate 15 that can accommodate smaller volumes. And this SepMate 50 tube can accommodate start volumes of whole blood from 5 to 17 mils. So here I'm just going to do a quick little mix before I aspirate. That's 5 mils. Dispense this into the dilution tube. And then I'm going to dilute it with PBS and 2% FBS. Here I'm just going to add an equal amount. So to my 5 mils of whole blood, I'm going to add 5 mils of PBS and 2% FBS. Okay, so here I'm just going to dispense this whole 10 mil diluted volume into the SepMate tube, which has been prepared. And I like to just place the tip here and then in the beginning, you can try doing a slow dispense, but it really shouldn't make too much of a difference. You can see that this is certainly a lot faster than having to do a traditional FICO non-SepMate layer. You'll also notice that there will be a little bit of mixing between the dispensed diluted blood and the lymphoprep. That's perfectly okay. As well, you might get a little bit of the whole blood going underneath the insert, and that also is okay. A good tip to give you is that when you're dispensing, you should keep the tube vertical. This will help minimize how much of the blood can mix in with the actual density underneath. Now be aware that you are going to get a little bit of the whole blood going just slightly underneath the insert, but this is perfectly normal. Now that it's dispensed, all you have to do is cap the tube and do a density centrifugation. In this case, this blood was harvested about 24 hours ago, so it will be a 1200 times G spin with the brake on for 20 minutes. If the blood was fresher, meaning less time had elapsed since it was drawn, let's say 12 hours or fresher, then you could get away with a 10-minute spin. But typically, for older blood samples such as this one, I would recommend doing a 20-minute spin, 1200 times G with the brake on. So here I have the SepMate, which we're going to spin. And you'll notice that over time, a little bit of red blood cells will start to pellet down. That's perfectly normal. We're going to be spinning at 1200 times G, in this case for 20 minutes, because this is 24-hour-old blood. And we are going to set the acceleration to 9, the deceleration to 9. If you have a instrument such as this one that you can set the deceleration to 8 or 7, you could, if you wanted to, adjust it to that. However, it's perfectly fine just to have it at the top deceleration setting when you're working with SepMate. Make sure, of course, that your tubes are balanced. And then you're going to want to close the lid and hit start. And it's always good practice just to wait for the centrifuge to get up to speed before walking away. There we are, 1200 times G, 20 minutes, brake on. Okay, so here it's been 20 minutes and the run has finished. So we're just gonna open this up. And normally best practice is to open these in the biosafety cabinet. So that's what we're gonna do. So here, I'm just gonna open this up and I'm pretty sure this is just the balance that we were using. So we'll set that aside. And here we have our actual SepMate spin. The idea is that when you pour this, what you want to do, with the cap off obviously, is that you want to do this in one smooth, confident motion like this. Okay? You don't want to be hesitant, because if you're hesitant, when you're going through the diagonal, that's exactly when the layer underneath can come out. So one smooth motion, wait for 1, maybe 2 seconds, and then back. So you'll notice that after you take your SepMate tube out of the spin, that you're going to have this yellow diluted plasma layer at the top. Then you're going to have this slightly hazy white layer, which are your desired peripheral blood mononuclear cells. And then just below that, you're going to have the density media plus your red blood cell and granulocyte pellet at the bottom. Okay, so here you have the tube coming out of the non-SepMate spin. And you'll notice that at the very top, very similar to your SepMate, you're going to have some diluted plasma. That's the yellow layer. Then you're going to have this fuzzy white PBMC layer. Just below that, you're going to have some density media. And then just at the very bottom, you're going to have your red blood cell granulocyte pellet. Okay, perfect. So here, once you're ready to pour, take off the cap. And then in one smooth motion, you're going to pour and then hold it upside down for 1 second and then pour back. Done. You'll notice that after you pour, this is what I always like to show, that if you invert the tube completely upside down, it doesn't come out all that much, okay? But if I hold this diagonally, that's exactly when it starts to come out. So that's why you want to make sure that when you do the pour, that you're confident and quick. You want to minimize the amount of time that you're holding it diagonally. You want to do a nice quick inversion. After you've poured out your desired PBMCs, then you're going to top up with PBS and 2% FBS to wash. The reason why you want to do a wash is that over time, density media can be a little bit toxic to the cells. So you really want to get that out of there. And we're just going to spin this for 300 times G, 10 minutes, break on. So here I just have a balance, and I'm going to be spinning the wash. Typically, we suggest doing 300 times G for 8 to 10 minutes. In this case, we can just do it for 8 minutes. If we want to do it for a little bit longer, say 10 minutes, that's perfectly fine. So it's going to close this up. Okay, and then we have 300 times G, 8 minutes, acceleration on, deceleration on, start. So here we have, after the first wash, we did 8 minutes for 300 times G. You can see here that there are a few red blood cells along with your PBMCs, and that is perfectly normal. This is very similar to what you would see with or without the SepMate tube. So if you were doing a regular density spin without the SepMate insert, you would also see these red banding. So at this point, your options are to either decant by pouring or to simply aspirate out. Most customers, because they're interested in getting through this quickly, what they will do is they will just decant. Just be aware that if you are very recovery oriented, you could elect to just pipette off carefully. Okay. And you'll notice that there'll still be a little bit of liquid here at the bottom. And what you want to do is just gently agitate that to break apart the cell pellet, because typically we recommend to do a second wash. Be aware that if you are particularly concerned about platelets, you could do a slow spin. So that would be 120 times G for 10 minutes with the break off. However, what most customers do, unless they're concerned about platelets, is that they will retop up with buffer, which is your PBS plus 2% FBS, and respin at 300 times G for 10 minutes with the break on. So let me proceed with that. And then we'll finish that last spin. After that last spin is done, then we will do a cell count. So here we have our SepMate tube after the second wash. And you can see that it looks very similar to the first wash, but by doing that second wash, you're able to better ensure that you've really removed most of that density media, because you don't want that kicking around. Okay, and I just wanted to focus in that red blood cell pellet, or the red cells, are still among the pellet. And then just agitate it to break up the cell pellet. And normally I would add about 1/2 ml to count. Or if you are going to be cryopreserving these, then you would follow your cryopreservation procedure. So we're just looking here how after we've agitated the pellet, some of those red blood cells will go back into solution, and so they will give a bit of an orange or pink tinge to the color of the pellet. That's perfectly normal. So here we've taken out the non-SepMate spin after 300 times G 10 minutes, and you can see that at least with this donor, it's very similar to the SepMate spin. So there is a little bit of red blood cells among your white blood cell PBMC pellet at the bottom. Okay, so it really talks to how SepMate, it just makes your density spinning faster and easier, but it's not supposed to enhance the removal of red blood cells or granulocytes from the PBMC layer. That is more of a biological constraint and consideration that the extent of which will vary depending on the donor-to-donor variation. The extent of the amount of red blood cells will depend on the donor and also how much time has elapsed since the blood has been drawn from the donor. Okay, so here we've taken our non-SepMate tube after the second spin, and you'll notice that very similar to the actual SepMate that we had done, there is some red blood cells among your white blood cells. So I suspect that once we've removed the supernatant and agitated the pellet, that it will again look a little bit orange, a little bit pink. As with before, you could do a pour off or you could aspirate off. It really depends on your comfort level. If you're going to be worried about recovery, then I would suggest doing a pipette off carefully. We're just going to decant because that's what most customers like to do. Okay. And then you will agitate your cell pellet a little bit just to break it off. Always easier to break apart the pellet when there's minimal volume. You can see very, very similar to our SepMate. The color actually looks very similar, I think. If anything, I would say that the non-SepMate looks a little bit redder.